Have you ever wondered what the early warning signs of bladder cancer might be? Well, you're not alone. It's a question that could be on the minds of many, given that bladder cancer is among the top 10 most common cancers worldwide. It's not just about the numbers though. What makes bladder cancer a topic of concern is its often silent and overlooked nature. Early detection, as with many health conditions, plays a pivotal role in its treatment and management. The earlier it's caught, the better the prognosis. So, understanding the early warning signs is not just beneficial, it's crucial. It empowers us to take charge of our health, to stay vigilant, and to seek medical help promptly when something doesn't feel right. And that's what we're here for. Knowledge is power. And today we will share with you the 10 early warning signs of bladder cancer. Sign number 1, changes in urinary habits. Now what does this mean? Well, bladder cancer can often lead to certain shifts in how and when you use the bathroom. Some people may find themselves needing to urinate more often than usual. This isn't just drinking a lot of water and then going to the bathroom. This is an increased frequency without a clear cause. For others, it's not about frequency, but urgency. They might feel a sudden strong need to urinate, even if their bladder isn't full. In some cases, people with bladder cancer might also experience a feeling of incomplete bladder emptying. That's when you've just been to the bathroom, but it feels like you still need to go. These changes can be subtle and easily dismissed, but remember, they could be early indicators of something more serious. If you notice any of these changes, it's important to consult with your healthcare provider. The second warning sign to watch out for is blood in the urine. This isn't something to brush off or ignore. When it comes to bladder cancer, blood in the urine or hematuria is one of the most common symptoms. It can range from microscopic levels that are only detectable under a lab microscope to visible discoloration that can turn your urine pink, red, or even a dark cola color. Hematuria doesn't always mean you have bladder cancer, as it can also be a symptom of other urinary tract issues or even simple dehydration. However, if you notice any changes in the color of your urine, especially if it's accompanied by other symptoms we're discussing today, it's crucial to seek medical attention immediately. Remember, early detection is key in successfully treating bladder cancer, so never ignore visible blood or changes in urine color and seek medical attention immediately. Third on our list is painful urination. This is a symptom that can be particularly distressing. Imagine feeling a burning sensation or even sharp stabbing pain every time you need to use the restroom. This is the reality for some individuals with bladder cancer. Bladder cancer can cause changes to the lining of the urinary tract. These changes can lead to inflammation, which in turn can cause painful urination. The pain can range from mild discomfort to severe pain that can interfere with daily life. It's important to note that while painful urination can be a sign of bladder cancer, it can also be caused by other conditions such as urinary tract infections or kidney stones. Therefore, experiencing painful urination doesn't mean you definitely have bladder cancer, but it is a sign that you should seek medical attention. Remember, any form of discomfort or pain during urination is not normal and should be checked out. The fourth sign is persistent lower back pain. Now when we say persistent, we mean pain that sticks around longer than usual, perhaps even for several weeks. This type of discomfort is not your average ache from lifting something heavy or sleeping in a weird position. It's a continuous nagging pain, often located in the lower back or flank region. This pain can be indicative of bladder cancer. It's believed to occur because the cancerous growth in the bladder begins to exert pressure on surrounding tissues and nerves. This increased pressure can lead to discomfort or pain in the lower back. It's important to remember that lower back pain can be a symptom of many other conditions as well. So, don't panic if you experience back pain. However, if this pain is consistent and especially if it's associated with urinary symptoms like blood in the urine or painful urination, it's crucial to seek medical advice. Consistent lower back pain, especially when associated with urinary symptoms, should not be ignored. Next on the list is unexplained weight loss. A sudden drop in pounds can be a sign of many health issues, including bladder cancer. When your body is fighting against a disease, it utilizes more energy than usual, resulting in weight loss. This weight loss is often unnoticeable at first, and you might even be pleased to see those few pounds drop off. But it's not the kind of weight loss that comes from a healthy diet or regular exercise. It's weight loss that happens without trying, and it can be a cause of concern. Cancer cells also produce substances that change the way the body metabolizes food. This can lead to weight loss as well. Furthermore, bladder cancer can cause a loss of appetite, which can contribute to this unexplained weight loss. So, if you notice that you're shedding pounds without any changes in your diet or exercise routine, it might be more than just a fluke. Unexplained weight loss, especially when combined with other symptoms, warrants a checkup. Sign 7. Swelling in the legs. Swelling in the legs can be a surprising and often overlooked symptom of bladder cancer. This happens when the cancerous cells block the flow of lymph, a fluid that circulates through the body's tissues, collecting waste products. When this flow is obstructed, fluid can accumulate in the lower limbs, causing visible swelling. This condition, also known as lymphedema, is not exclusive to bladder cancer and can be associated with various conditions. However, when paired with other symptoms we've discussed, it can be an important clue pointing towards bladder cancer. Swelling may be more noticeable in one leg than the other and can vary from mild to severe. It's crucial to remember swelling could also be due to other less severe conditions like varicose veins or a sedentary lifestyle. But if you notice unexplained leg swelling, especially with other symptoms, it's time to visit the doctor. 8th warning sign is bone pain. Now you might be wondering, how can bladder cancer cause bone pain? Well, it's actually an indicator that the cancer might have metastasized or spread from the bladder to the bones. This isn't common in the early stages, but if you're experiencing persistent, unexplained bone pain, it's worth getting checked out. When cancer cells invade the bone, they can disrupt the balance between the bone's natural process of breaking down and rebuilding. This disruption can lead to pain and sometimes fractures. The pain is often described as deep, throbbing, or aching, and it's usually continuous, unlike the pain caused by a muscle injury or arthritis, which often comes and goes. Remember, bone pain doesn't necessarily mean you have bladder cancer. It could be due to other health conditions. But if it's persistent and unexplained, it's important to discuss it with your healthcare provider. Persistent bone pain should always be evaluated by a healthcare provider. The 9th sign is constant fatigue. Now, we all feel tired from time to time, but constant unexplained fatigue can be a warning sign of something more serious, like bladder cancer. This isn't just about feeling sleepy after a long day or needing that extra cup of coffee in the morning. We're talking about a persistent, lingering fatigue that doesn't seem to go away no matter how much rest you get. This kind of fatigue can make it difficult to perform everyday tasks or even get out of bed. It's a type of tiredness that feels more profound, almost like an overwhelming sense of exhaustion that permeates your entire body. Now remember, fatigue is a common symptom for many conditions, not just bladder cancer. But if you're experiencing this kind of constant fatigue, especially if it's accompanied by any of the other signs we've discussed, it's crucial to consult with a healthcare professional. If you're feeling constantly tired, and it's not due to overwork or stress, it might be time to get checked. The final warning sign is anemia. Now, anemia is a condition where your body lacks enough healthy red blood cells to carry oxygen to your tissues. In the case of bladder cancer, anemia can occur due to blood loss from the cancerous growth in the bladder. When your body doesn't get enough oxygen, you may experience symptoms like fatigue, shortness of breath, and even paleness. Now, it's worth noting that anemia isn't exclusive to bladder cancer. It can be a symptom of many other conditions, including other types of cancer, iron deficiency, or even just a side effect of certain medications. However, if you're experiencing anemia along with the other warning signs we've talked about in this video, it's definitely something to bring up with your doctor. Just remember, early detection is key in managing and treating any form of cancer. Anemia, especially when accompanied by other symptoms, should be investigated. To summarize, bladder cancer can show itself in many ways. It might start with unusual urinary habits, maybe you're going more often or less. Perhaps you find blood in your urine, a definite red flag. Then there's painful urination, a symptom that should not be ignored. Lower back pain, often dismissed as a sign of aging or stress, could also indicate a problem. Unexplained weight loss too can be a signal of something more sinister lurking within. The swelling in your legs isn't always about long hours on your feet. It could be a warning sign. Bone pain, fatigue, and anemia. These are all potential early indicators of bladder cancer. Each sign alone may not mean much, but together, they paint a picture that should not be overlooked. Remember, early detection is key in the fight against bladder cancer. Stay vigilant and always consult with your healthcare provider if you notice any of these signs.